Assistant Professor, National Institute of Mental Health and Neuroscience, Bangalore. Dr. Indranil Bosu Roy, Founder, Chairman, American Association of Yoga and Meditation. I am extremely happy to say that we all are going to be enriched from two eminent resource persons of this program. I do welcome also Professor Dr. Suvojit Ganguly, Head of the Department of Organo Medicine, and Professor Dr. Shubhomay Ghosh, Head of the Department of Pathology, two faculties and members of our DNA Homeopathic Medical College and Hospital family. I am sure all attendees will be enriched from their vast knowledge. My heartfelt welcome goes to the moderators of our program, Yogacharya Dr. Chanchal Rai, Dr. Aurobindo Brahmo, Professor Dr. Satodal Das, Professor Dr. Sumiran Mondol, Professor Dr. Pradeep Kumar Bairi. This institute is highly grateful of these wise men for their kind presence. Today we have the great opportunity to learn and share, to integrate the knowledge of different branch of medical science with yoga and ancient knowledge of mental and physical well-being that great species of our motherland had given us. Dr. Hahnemann said, physicians' high and only mission is to restore the sick to health, to cure, because it is the healthy mind and body who can achieve the highest purpose of our existence. Actually, the term yoga means union. The highest purpose of yoga is the union of one with the universe, union with the Jivatma and Paramatma, the ultimate divinity, the Param Brahma, the highest purpose of our existence. For this, one requires healthy mind and body, because it is the primary and physical body with which one can make the inward journey to reach beyond body and mind, the Param Chetan. Dr. Hahnemann clearly told us the vital principle. The Jivan Shakti can only rule in unbounded sway when one is balanced within his mind and body. As Swami Vivekananda uttered, Atma Balena na Labho, inspiring from the holy words of our Pranay Thakur, Sri Ramakrishna, Jato Mat, Tato Path. Let us all come together and share our knowledge of different branches of medical sciences and yoga and devote ourselves to serve the suffering individuals, reach the highest purpose of existence, because Jive Prem Kore Jaijon Seijon Seviche Ishwar. With these words, once again I congratulate one and all of these august gatherings in this webinar and hope this iconic institution would always remain an inspiration to all homeopaths across the globe. Last of all, I thanks to our PGO Welfare Committee, those who organized this two days program. May the blessings of Almighty be with us, guiding light in the search of truth. Again, I thanks to our coordinator and anchoring our beloved professor, Dr. Suvojit sir. Thanks to all. Okay.
Thank you, sir. Thank you, sir, for your words of encouragement and inspiration, and guiding us with your untiring zeal to organize such programs. We would just really apologize. We are facing some technical problem to join with the inaugurator, Dr. Subhash Singh, sir. May I request the technical team to please check whether Dr. Subhash Singh has joined the meeting or not, please. Good morning, sir. We have with us Honorable Chief Guest for the webinar, Dr. Subhash Singh, sir, Director, National Institute of Homeopathy. A man with many qualities, from being an able administrator, renowned speaker, dignified educationist, and above all, a lover of homeopathy. On behalf of DMA Homeopathic Medical College, I would request sir to please inaugurate the webinar. Over to you, sir, please.
I am audible?
Yes, sir, you are audible, please.
Thank you. Thank you, Dr. Sangeeta. Thank you very much for giving me this opportunity. A special thanks goes to the head of the institute, Principal Professor Dr. Shamal Kumar Mukherjee, for having me here. We all know that yoga is a very integral part of Indian culture. And in today's time, when we are facing this pandemic, yoga is helping everybody, whether they are sick or post sickness or they are healthy, to overcome the mental stress that we are facing, to overcome the physical strain that we are facing. Yoga, we all know, yoga means to add. So yoga is adding a quality to our life. And as Master Hahnemann has said in aphorism 9, let me read it for you. In the healthy condition of man, the spiritual vital force, the dynamism that animates the material body, rules with unbounded sway and retains all the part of the organism in admirable, harmonious, vital operation as regard both sensation and function, so that our indwelling reason-gifted mind can freely employ this living, healthy instrument for the higher purpose of our existence. So, in order to retain this, all the organism, all with sensation, with function, and with part in a harmonious condition. And this harmony is not within ourselves with each part or each sensation, but this harmony should also exist with the outside. And yoga here helps a lot to attain this harmony. We all know that homeopathy acts on person as a whole, on individualization. So yoga in a similar way, it affects the person as a whole. In homeopathy, we all are aware that we believe that medicine do not cure, but medicine helps the vital force to get rid of the disease and to cure. In a similar way, with the help of yoga, we can strengthen the vis medicatrix and make us more free of health disease. And if we are healthy, then to attain better health, for this yoga helps a lot. As far as whether homeopathy and yoga are compatible or not, all of us know that yoga is a non-medicinal management. We know that treatment is not limited only to giving a prescription, but the whole management of the disease, in which yoga helps a lot. And Master Hahnemann has talked, at that time yoga was not known in this form, but he has talked in indirect way, and he has said that whether it is physiotherapy or hydrotherapy or different methods of non-medicinal management, they are very well goes with this homeopathic treatment. So thank you very much all who are attached with D&A Homeopathic Medical College and Hospital, and especially Dr. Shyamal Mukherjee, for taking this initiative where we can think of yoga and homeopathy going together. From NIH, we have published a small booklet on the occasion of World Yoga Day, and I'll share the PDF with Dr. Shyamal Mukherjee, and anybody who is interested that how yoga and homeopathy goes together, they can get a copy from him. So once more, thank you, my friend Dr. Shubhamay Ghosh, Dr. Shubhasis Ganguly, Dr. Sangeeta Saha, and all the faculty members, especially Dr. Shyamal Mukherjee, for having me here. Thank you. Jai Hind.
Thank you, sir, for your kind presence, and especially about the brief introduction about the utility of integration of yoga with different disciplines of medical science. May I please request you to please inaugurate the webinar, sir? With your permission, can we please inaugurate?
Thank you, Dr. Sangeeta. It's my honor to hereby officially inaugurate this webinar, and I'm sure all the audience and who are attending, they will be much enriched with the knowledge. Thank you very much. My pranam to Master Hahnemann, because of whom we all are here. Thank you very much.
Thank you, sir. We now move on to the webinar proper. We shall now commence with the first scientific session of this two-day webinar. Our distinguished speaker for the first session is Dr. Hemant Bhargav. Dr. Bhargav is presently serving as Assistant Professor, Department of Integrative Medicine at NIMHANS, Bangalore. Dr. Bhargav obtained his MBBS degree in 2008, pursued MD in Yoga Therapy, MSc in Psychology, and obtained PhD in the field of Yoga and Brain Hemodynamics from S. Vasa University, wherein he was awarded Gold Medal for the Best PhD Thesis in 2017. He is having immense expertise in clinical methods, therapeutics, research in the field of integrative medicine, with more than 70 publications in various peer-reviewed journals. Many research have been completed, are being carried out, and some are being carried out under his able guidance, a very renowned orator. Today, Dr. Bhargav shall share his expertise on application of yoga in mental health, and the session will be moderated by Dr. Arabinda Brahma. Dr. Arabinda Brahma, he is MD in the field of psychiatry. He is presently serving as consultant psychiatrist, Kolkata Police Hospital and Bharat Seva Shram Sangha Hospital, Kolkata. He is the honorary lecturer, Indian Psychoanalytical Society, Kolkata. He has received many awards. Some of them are Mother Teresa Sadbhavna Award, Bharat Gaurav Award in 2015, Bhagwat Award in 2007, Marfatia Award in 2014. His field of interest is community psychiatry and suicidal behavior. May I now request Dr. Bhargav to commence his session. Over to you, Dr. Bhargav, please.
Thank you very much, Dr. Sangeeta. I am really grateful to Dr. Shubhamay Ghosh for giving me this opportunity. I would like to share my slides now. Dr. Sangeeta, are my slides visible?
Yes, sir, your slides are visible.
Thank you. So once again, congratulations to the organizers from D&D Homeopathy Medical College and Hospital, Kolkata, since the webinar, the theme of the webinar is integration of yoga with different disciplines of medical science, I will be focusing on how we have integrated yoga into the field of mental health at NIMHANS. So as we see, the very definition of yoga that comes from Patanjali describes it as a technology science which focuses only on the mental health aspect. Yoga chitta vritti nirodha means that the basic definition of yoga is that it calms down the agitations of the mind. So what I mean to say is that as yoga evolved thousands of years ago, its predominant role was addressing the mind, and therefore it is but natural that we are finding a lot of good evidences of yoga in terms of its impact on the psychological health as well as the brain health. So very quick overview that yoga according to Patanjali consists of 8 limbs, and these 8 limbs cover different dimensions of health, and this goes very well in terms with the definition of health by the World Health Organization, where yamas and niyamas are the do's and don'ts to manage the behavior of the individual. They work at the behavioral level. Asanas and pranayama work at the physical level, and then the pratyahara and dharana are working at the mental level, and dhyana and samadhi work at the spiritual level. Ultimately, all these approaches of social conduct, bodily postures, regulation of the breath, control over the sense organs, and dharana, that is focusing of the mind and defocusing of the mind in dhyana. Ultimately, the mind-body approaches, the behavior, and the direct dealing with the mind, all of them are aiming at calming of the mind. So, as described, different dimensions of yoga work at the different levels of health, and there have been a lot of scientific researches in the last 2 decades. Yoga has emerged as a very popular mind-body approach to deal with psychological disorders as well as to promote positive health and mental well-being. Different researchers have explored different components of yoga. Predominantly, the Western authors have explored the physical aspect of yoga, that is the Hatha Yoga and the asanas, whereas in the researchers in India, it is the integrated approach of yoga which is more popular, where all the dimensions of yoga are used together. Authors also argue that yoga, rather than a half an hour practice, it is a kind of a lifestyle which should be incorporated in the day-to-day life. And the researchers show that predominant impact of yoga on the body physiology is through modulation of the hypothalamo-pituitary adrenal axis, the neuroendocrine axis. The down-regulation of HPA axis leads to reduction in serum cortisol levels, and that is how yoga combats stress. Similarly, researches by Streeter et al. Have demonstrated that yoga can enhance the gamma-aminobutyric acid, GABA. Now, GABA is a neurotransmitter. If it is more in our brain, then it has a calming, relaxing effect. It reduces anxiety. And mostly it appears that the central mechanism through which yoga produces impact on the body may be predominantly through the GABAergic mechanisms. Also, number of researchers have shown modulation of various other neurotransmitters. At NIMHANS, we have been able to demonstrate that in depressed subject, yoga enhanced BDNF levels. Now, BDNF is called as brain-derived neurotrophic factor. This is a growth factor released in the brain, and it is a marker of the ability of the brain to form new neurons as well as to form new synaptic connections. And it is known to reduce in chronic mental health disorders, but we have been able to demonstrate that it increases after 8 weeks of practice of yoga. Similarly, immunomodulation is another way in which yoga works. A systematic review of 15 RCTs demonstrated that yoga practice can reduce pro-inflammatory markers like IL-1, IL-6, TNF-alpha, and it enhances the T cell functions. So considering the current COVID-19 pandemic scenario, yoga is an optimal way of dealing and modulating the immune system. Another mechanism through which yoga works is by activating and deactivating different brain regions, and also bringing a state of parasympathetic dominance, enhancing the sympathovagal balance. And ultimately, all these effects have translated into reduction in depression, anxiety, negative symptoms in schizophrenia, as I will demonstrate in detail. In schizophrenia, people do not socialize much; they are completely withdrawn. Whereas after a practice of yoga regularly, their tendency to mingle with others, socialize with others improves. Similarly, researchers have shown that yoga can enhance quality of sleep, cognition, and attention. Looking at the subjective ways in which yoga works, this was a interview conducted of people who have done some regular sessions of yoga, and they were asked whether subjectively what changes they felt after some sessions of yoga. So people reported, number one was that they felt calm, relaxed. Number two, they felt that they became more mindful of the day-to-day activities that goes on around them. Number three was a feeling of compassion, not only towards others, but also towards oneself, and feeling a sense of connectedness with yoga teachers, with fellow yoga practitioners, and with nature in general. Ultimately, these things translate into a better intrapersonal relationship between the individual, within the individual and his own energies. His self-image improves, his self-esteem improves, and then the interpersonal relationship also becomes better. And this intrapersonal relationship improvement leads to enhanced health, resilience, and well-being outcomes. Now coming to what kind of neuroprotection can yoga offer? So this is a famous research by Lazar et al. Group published in 2015, where they ran a correlation between the total gray matter volume and age of two groups. One were a group who were regular yoga practitioners. They practice yoga at least for 3 years, and other were control group who had never practiced yoga in their life. So regular yoga practitioners had a much lesser decline in their gray matter volumes, and as you can see, people who did not do yoga, the decline in the gray matter volume with age is quite steep. Now we all know that the shrinkage of the brain is a natural phenomena as we age, but then it is also a risk factor for the illnesses like dementias and Alzheimer's disease, which are reaching epidemic proportions, and it is projected that by the year 2030 these will be the major cause of mental comorbidity over the world. So therefore, yoga looks like a need of the hour, especially for the middle-aged people as they age further. We at NIMHANS were able to demonstrate in 120 subjects, randomly divided into two groups. It was a community-based research where we went into old age home and taught yoga to old age people. In fact, the old age homes were randomly divided into two groups, and one group received yoga for 6 months, other group served as a wait list control. And what we observed that in 6 months of yoga intervention, a 1 hour intervention with some lifestyle changes, went on for 5 days a week for 6 months. And we observed an improvement in their memory, executive memory, recall. Not only that, a small subset of the population demonstrated that not only that the shrinkage of the brain, which is a natural phenomena, reduced or got halted, but there was also a mild increase in the size of the hippocampus. It means that yoga did not only reduce the shrinkage, but also enhance the size of the brain in elderly people. So these participants were above 50 years of age, and we know that hippocampus is the major area which shrinks in Alzheimer's disease. And here we were able to demonstrate that yoga increased the hippocampal volume. So overall, if you see that in healthy people, yoga has a tendency to enhance resilience and reduces cortisol levels, the stress hormone, therefore reduces the risk factor for anxiety and depression, improves quality of life overall. It also enhances their, gray matter volume, their cognition and attention processing, and the oxidative stress. So overall, yoga, we can say that yoga offers a protection against mental health disorder, and more research is required in this domain, where preventive role of yoga in psychiatric disorders. So role of yoga in preventive psychiatry needs to be studied, but I think it is a good move to include yoga in schools, colleges and universities, not only for the students but also for the staff in general. Now coming specifically to role of yoga in psychiatric disorders, I will focus more on the researches that we have done at NIMHANS. So this is a meta-analysis of 10 major studies which focus on different kind of psychiatric disorders, and the pooled effect size of yoga was in favor of yoga, that yoga works as a complementary therapy in different kind of psychiatric illnesses. And there is a tendency now that yoga has been recognized as a therapy, and many of the psychiatrists are including yoga in their clinical practice and are hiring yoga therapists. So this is another meta-analysis on the studies that have been published so far on depression. So as you can see here, that most of the studies on depression, almost all of them, have shown that yoga reduces the scores on depression. And these are studies not only comparing yoga versus usual care, but as compared to active control groups such as relaxation and aerobic exercise, also yoga has been found to be more effective. This is a research that we conducted at NIMHANS, the Sudarshan Kriya Yoga practice of art of living. People were divided into 3 groups. One group received yoga, other group received antidepressant drug imipramine, and third group received electroconvulsive therapy. Now, ECT is the mainstay of treatment in severe depressive patients, major depressive disorder. But here, what we observed was that in the number of weeks, you can see here that the depression scores came down, but the Sudarshan Kriya Yoga group showed a reduction in their depression scores, which was comparable to imipramine drug, but both the groups were less effective than ECT. So yoga was as good as antidepressant drug imipramine. And then this is a research published by Sudha Pratikanti et al. From University of California, San Francisco in 2017. Now, this is a study where yoga was used as a monotherapy for depression. It means patient did not receive any kind of antidepressant. Of course, they belong to mild to moderate category and they did not have any suicidal ideations. If patients have suicidal ideation, then it is better to give yoga as an add-on to medications. It is not advisable to give only yoga to people who have suicidal ideations. But then if the symptoms are mild to moderate, then the study showed that as compared to a attentional control group, one of the criticisms that yoga researchers receive is that patients in depression improved not only because of the practice of yoga, but because of the interaction with the therapist. They came out, they met everyone, they spoke to therapists gave them personalized attention, and this is what led to improvement in their symptoms, but not the practice of yoga. But here in this paper published in a good impact journal called PLOS ONE, the control group had matched number of interactions between the therapist and the client and the people around them. So even if the attention was matched, yoga was better. And these effects were observed in a duration of as less as 8 weeks. And mind you, the interventions usually in the Western studies are given only on the weekends. They perform 1.5 hour yoga on Saturdays and Sundays, and then they were given some material. But as compared to that, the studies in India, they focus on 1 hour of yoga every day, 5 days a week. So the effect sizes are definitely more in India's studies. But even if you just do yoga on weekends, 2 hours or 3 hours per week, that also produces a significant change in your mood. Our researchers show that if you want to have a sustained benefit with yoga practice, you should do at least 3 sessions per week. That is 1 hour session. So 3 hours per week is the recommended dose. This is a journalist who came to Nimhans from England, and she wanted to know the researches that we have done in terms of the effect of meditation and the sound Om and its impact on brain health. She published this study actually in Financial Times, London, when she came here, and the review she published. So the device that she is wearing is known as the functional near infrared spectroscopy device. It is also called as poor man's MRI, because the device is portable, it is very cost effective, and it sends a near infrared range of light around 600 to 900 nanometer range wavelength of light into the brain, and this is absorbed selectively by the oxygenated and deoxygenated hemoglobin in the brain capillaries, and the remaining light is reflected back, which is received by the sensors. And through this, we come to know whether there was a oxygenation or deoxygenation in the brain. Of course, this device can only be used in the superficial layers of the cortex. But we were able to demonstrate that when people perform certain kind of breathing practices or certain kind of chantings, it can produce differential activation and deactivation in different brain areas. So here, actually, we did a MRI study, and 12 subjects, healthy subjects, lied down into a MRI scanner, and they chanted Om in the ratio 1:2. Om. So 5-second O and 10-second Ma, and they repeated it in 10 sets. And what was observed, that as compared to the control sound, that is matching the ratio of the breathing, exhaling for 15 seconds in both the groups, in both the interventions, it was observed that people who chanted Om had a deactivation of the midbrain area called limbic cortex. Now this limbic cortex contains amygdala, hippocampus, which are all associated with negative memories, negative thinking, anger, frustration, jealousy. And it was observed that chanting of Om calm down these areas of the brain. Similarly, using that FNIRS device, we performed a study, and we observed that Kapala means forehead, Bhati means shining. So here, I was wondering, a practice where there is a flapping of the abdomen, you know, Kapalabhati, why the name Kapalabhati was given, that forehead shining breath. So actually what we understood was that if you perform 1 minute of Kapalabhati in the range of 90 to 100 strokes, 120 strokes per minute, so the frequency of 2 strokes per second, it causes activation of the prefrontal cortices. So Kapalabhati means oxygenation in the frontal brain area. Similarly, we have done this research on patients of schizophrenia, where we observed that in 12 weeks of yoga intervention not only led to improvement in their quality of life, but on validated scales, we could observe that their depression reduced, their ability to socialize became better, negative symptoms drastically came down. There was also a slight reduction in their aggression, positive symptoms. Most importantly, the SOFS, socio-occupational functioning scale. People started socializing and maintaining their occupation better. So there was an improvement in their real world functioning. One of the subjects I still remember that after this study, one lady came to us and told us that for the first time in last 15 years, my son on my birthday has gifted me a sari, and the sari, he said me that is of orange color, and he told me that, Mom, because this is your favorite color, I got this color sari for you. And the lady became emotional and said that yoga gave me my son back. So that is the kind of impact that yoga produces, enhances the empathy and connection in patients with schizophrenia, where schiz actually means a split. The people gets disconnected. They cannot connect with the emotions of others. But here we were able to see that yoga improves that, that connectivity. Similarly, we were able to, as I told you, that we were able to demonstrate that yoga was better than exercise in bringing these kind of changes. Now people ask, exercise also works, and what is the difference between yoga and exercise? The main difference is that yoga involves coordination of the body, breath, and mind together. Many people come to us, they say, I go for a walk, I go to gym, I do cardio, but there is no improvement. Because what happens is, whenever you are doing these changes, the mind still continues to keep thinking. Whereas when you do yoga, you have to coordinate your breath with your postures. You have to become mindful of the part of the body which is being stretched. So this mindfulness, breath regulation, and also yoga involves a component of relaxation at the end and in between the practices with deep internal awareness. These all bring a different dimension of changes which are not possible with exercise only. In fact, this research that we did here at NIMHANS was recognized by the NICE guideline published by the UK, and it was considered as a high quality evidence. And from then on, yoga was recommended as one of the treatment modalities for schizophrenia. So what precautions should we take when we are dealing with patients suffering from different kind of psychiatric disorders? So here I would like to suggest that make sure that the caregiver is present when you are delivering, especially the initial yoga sessions. Our experience shows that first 10 sessions should be given under supervision. And after 10 sessions are required for people to learn it properly. And then people can continue on their own, or they can continue through tele-yoga. Now, tele-yoga also has emerged as a very popular intervention. We actually performed a survey of patients of schizophrenia at NIMHANS and asked them whether they would be interested in doing yoga. 70% of the patients said, yes, we will be interested. But then we asked them what prevents them to attending yoga or doing yoga regularly. So the number one barrier was the distance between their home and coming to the yoga center and practicing here. But now through tele-yoga, we have been successfully able to overcome that barrier. And even during the lockdown period, we continued all tele-yoga services. We have validated modules for anxiety, depression, schizophrenia, cognition enhancement in elderly, somatoform pain disorder, and substance use disorder. So people with these disorders were able to log in online through Zoom, and we gave them one session of yoga when they came here to our OPD and corrected their postures and told them to go home and log in through Zoom. And we were able to demonstrate that even if one supervised session is given and then patients are shifted to online, it is possible to do that. Of course, schizophrenia patients required around 5 sessions, but all other patients, anxiety, depression, substance use, one session was sufficient for them to do that. Another thing is that the lot of patients come to us who report side effects of yoga. By practicing yoga, sometimes their psychotic tendencies, especially bipolar and schizophrenia patients, sometimes they have a exacerbation of psychotic symptoms. There are two main reasons. One is that when they start doing yoga, they feel better on their own, they stop their medications. Second thing is, many of them go to YouTube and start learning yoga, meditative techniques, some Kundalini yoga techniques from YouTube. And then what they do is they completely withdraw all their senses and keep focusing on certain points of the body. It is proven beyond doubt that sensory deprivation can promote psychotic tendencies. So therefore, practices where person has to sit still for a long time, closing all the senses and focusing on certain parts of the body, may not be good for patients who have psychotic disorders. What we promote here is using the asana and pranayama aspects of the Patanjali's Ashtanga Yoga, including relaxations with eyes open and chantings loudly. Whereas patients with anxiety, depression, who do not have any psychotic tendencies can be given such meditative techniques also at the end, but still we feel that the pranayama and asana component should be more. Also, therapists should avoid touching the patient, especially if the patients are psychotic, they may have paranoid thoughts, and it may lead to some legal issues also. So it is always better to demonstrate the patient by doing yourself, and even if you have to touch, you should ask the permission of the patient first, and then tell him what you are going to do, and then touch the patient. This touching may be more important in patients who have early Alzheimer's. but then it is better to have a caregiver there. And rapport building is very, very important. Here, patients do group sessions, but the first session that we do, we make sure that the therapist has a one-on-one session with the patient. And then in this one-on-one session, there is a standard protocol that we follow. The therapist greets the patient and then listens to him about his concerns, and then asks him about if the patient has any comorbidities. Say somebody has hypertension, back pain, diabetes, then he tells him that this is the module I am going to teach you in the group tomorrow, but these are the practices which you should not do. And these are the practices which you should emphasize more based on the evidence. And this is how we also assess their gunas through Vedic personality inventory, the sattva, rajas and tamas, and give them the lifestyle according to that, the vata, pitta, kapha through Ayusoft device, and give them a dietary prescription according to their nature, and then make them do a yoga program. So this is how we have incorporated yoga based lifestyle as a tailor-made holistic approach, which is personalized for the patient. And this model has been working here for last 10 years, and we can say that this is a successful model for psychiatric patients for integrating yoga. Now, homeopathy is a very simple system where patient need not involve any kind of complication. It is free from side effects, and there can be no interaction between yoga and homeopathy. In fact, I feel that yoga may make the vital force in the individual more active, so that they respond better to homeopathy treatments. So a person who does a lot of good nadi shuddhi pranayama and balances his prana, which is very close to the vital energy that homeopathy physicians talk about. So the pranayama practices, pranic energization techniques may enhance the reaction of the body to the drug, to the homeopathy medicine, and they may give more potent responses with lower potency of the drug. So in that way, yoga can be integrated. Caregivers' inputs are very important. Always when you want to hear to a psychiatric patient, first hear to the patient, and do not call both the caregiver and patient together for interview. First hear to the patient, let the patient sit outside, then call the caregiver, listen to the caregiver's perspective, remain completely non-judgmental, and then decide the course of your therapy. You have to become a good listener if you want to become a good yoga therapist. Always teach yoga under supervision of a psychiatrist, and keep in touch with psychiatrists if you see any symptom aggravation in the patient or any improvement in the patient. The liaison with the modern medicine doctors is very important. Even if you are practicing homeopathy or you are practicing yoga therapy, please remain in touch with the modern medicine doctors, because the most important cause of relapse is patients' non-adherence to the psychiatric medications. Psychiatrists definitely deserve a credit that they have brought these patients who had psychotic illnesses in the previous century. We would say that most of these patients who had severe psychotic illnesses were locked up into asylums. But then if they are able to come out and mingle with the society now, it is all because of the development of the technology and the medications and ECT that modern medicine has given us. Now we can improve the quality of life of the patient, and especially in psychotic illnesses, the Ayush system's main approach should be that we should be able to enhance adherence of these patients to these medications and somehow try to reduce the side effects of these medications. We should never tell patients, especially those who have psychotic illnesses, to stop the medications without consulting a psychiatrist. Also, we have observed that as compared to one-on-one sessions, patient report more improvement with group sessions. So in summary, I can tell you these are the findings which we have got from researches done at NIMHANS so far. We have observed that there was a reduction in serum cortisol and increase in plasma BDNF in patients with major depressive disorder. There was improvement in social cognition as well as functioning as clinically, and biologically we observed that there was an increase in the hormone oxytocin, which is known as a cuddling hormone, which connects between mother and child. And this is what we observed, that the schizophrenia patient increased their oxytocin level, and this is how they were able to socialize better. Mirror neurons are situated at the base of the frontal lobe, and these are the neurons which are there in primates. And when a yoga therapist does certain posture and the patient imitates it, that leads to mirror neuron activation, and this can be another mechanism through which they are able to connect. Similarly, I showed you what research we have done in elderly. In alcohol and substance use disorders, we were able to demonstrate reduction in cortisol and ACTH levels. And we are investigating other psychiatric disorders where somatoform pain disorder, then opioid use disorder, those who are addicted to painkillers and heroin addicts, we are getting some encouraging results. And there is another dimension that we have opened now, that we are seeing the effects on migraine, multiple sclerosis, epilepsy, and other neurological conditions. So these are the ongoing activities at NIMHANS. Finally, I would like to just quickly show some practices which can be useful in promoting the mental health. This is a Trataka practice. In a windless place, you should keep a candle flame at a height where you can see straight. By keeping your head straight, you can look at the candle flame and focus and defocus your attention on the candle flame till tears roll down your eyes. Similarly, energizing asanas and relaxation practices after them, including Surya Namaskara 4 to 6 rounds in your daily routine, will be very helpful. Performing slow and fast breathing pranayamas with various mudras can enhance mental health. Chanting of mantras. The yoga should be considered as a science. If you feel that you cannot chant Om, yoga does not require any kind of prerequisite of any kind of religious belief to do the practices. We have seen that in fact, a lot of people from different religion come here and we tell them, if you do not want to adapt Namaskar Mudra, just sit with your palm facing upwards. If you feel that Om chanting is difficult for you, you just produce the humming sound. Or even if you chant Amin or Amen, it doesn't matter. You should just focus on feeling the vibration of these sounds in your body, because it is the vibration that is stimulating the auricular branch of the vagus nerve and therefore causing the deactivation of different brain areas. So mantra chanting based on their religious inclinations, we prescribe them. At the end, relaxation exercises are very, very important. So thank you very much for your valuable time and for giving me this opportunity. Thank you.
Thank you, Dr. Hemant Bhargav. It's really a wonderful presentation. You have so nicely described how yoga helps in tackling the mental health issues. And I know that Dr. B.N. Gangadhar in NIMHANS is doing a lot of work in NIMHANS, and you are working in that team, so you know how different kinds of mental health illnesses is tackled at your institute. So you have very correctly emphasized on the effect of chanting of Om, how it affects the limbic system, because we know the limbic system controls our emotion. So especially the amygdala, hippocampus or parahippocampal regions. And also how yoga helps to improve our social and occupational functioning skills. So we know that in NIMHANS, people are getting this yoga therapy on a regular basis. So, and many papers are coming out from there, and in our Indian Psychiatric Society also, Dr. B.N. Gangadhar is the chief advisor of the yoga subcommittee of Indian Psychiatric Society. So we also learn a lot from him when we meet, either physically or in webinar form nowadays. So it's really a wonderful session. I think all of us have learned a lot from your elaborative presentation. Now there is one question in the chat box. That is, there are lots of differences in techniques of pranayama between modern style and traditional style. In fact, in research also, they don't use that typical style of pranayama. My question is, what style general people should follow and why this difference? The question was asked by Dr. Biplab Burman. So if you please answer this question.
Thank you, Dr. Brahma, for your valuable comments, and thank you for asking this question. Yes, I completely agree that the way pranayamas are described in traditional texts and the way they are done now, there is a lot of difference. In fact, if you look at the traditional yoga texts like Hatha Yoga Pradipika, they actually talk about Antar Kumbhaka. When you breathe in, you have to breathe in and hold the breath to your maximum capacity and then breathe out from the other side. This is the kind of pranayama that they advise, and the duration that they prescribe also is quite long. You know, for complete cleansing of the nadis, they advise that you should do pranayama regularly for 3 months, and 80 rounds you should do every day. So what has happened here is that we are living in a fast-paced life, and people do not have that much time. So what has happened is that another thing is the research that the Antar Kumbhaka, holding of the breath, requires has not been done, because the same text also warns that if the pranayama are not done properly, they can lead to diseases. They can help in managing the disorders. If they are done improperly, they can lead to diseases. So therefore, the most simple way of doing the pranayama has been chosen, that is breathing in and breathing out without holding the breath, because it requires more scientific researches whether it is safe to do that for a long time. I would here like to show that we have published a textbook recently in collaboration with Indian Psychiatric Society, and this book actually provides different yoga modules that we have used in different psychiatric disorders and the techniques that how it should be correctly done. So I am just sharing the book on the screen here. So at the end of the book, there is an appendix of the list of practices that should be emphasized on people suffering from various psychiatric illnesses, and even for promotion of the health in healthy and for caregivers of patients. So this particular book is also available in Amazon. So correctly, if you want to do the practices, kindly follow the guidelines given in the book. And the discrepancy between ancient and modern understanding is because researchers show that these kind of breathing practices are more feasible now, and they require lesser time. Of course, we should try to do the practices as prescribed in traditional texts, but it needs more systematic research and testing of the feasibility, whether it is possible to do that now.
There is one more question from Dr. Biswajit Basu. AMU itself having no religious identification, have you studied the difference of chanting Om with other sound as you have uttered? It
Yes.
would be better to chant Om to get the best result. Yeah, your comment.
So basically, the study that we initially did, we did not use other sound. We just used Om, and the control was the hissing sound. And the deactivation that we got was because of the sound Om. And now there is a ongoing trial which is going on where we are comparing the sound Om with the humming sound. We hypothesize that the effect of the sound Om is because of the stimulation of the vagus nerve in the ear. We know that this vagus stimulation in the ear, electrical stimulation of the vagus nerve in the ear, is one of the treatment modalities for depression as well as epilepsy. So we are hypothesizing that Om chanting is a non-invasive neuromodulation kind of a technique which produces vibratory effect. But the result of that study we have still not analyzed. Still the data collection is going on. So far the evidence that we have is only for the sound Om, but we are hypothesizing that Om will be similar to the sound Ma, but we cannot definitively say that right now.
Okay. Just one question from my side, that you have already mentioned the precaution to be taken during for the mentally ill patients. So any particular precaution you are taking especially for the psychotic patients like schizophrenic patients? Any special precaution?
Yes. So the most important precaution is that we are completely avoiding meditative practices where they have to withdraw their senses and remain still for a long time, focusing on some kind of points in their body, or just observing their thoughts in the mind, or observing their breath. So that vipassana kind of meditation, observing the breath, focusing with closed eyes, we are avoiding that. Second thing, what we are doing is we are making these patients do the practices in groups. Thirdly, we instruct the therapist not to touch the patient. and demonstrate the practices from a distance. Even if the therapist has to touch the patient, he should first take the permission of the patient and then do that. Thirdly, these patients require a little longer time. They require 10 supervised sessions and then they are shifted through telemode. But it is feasible and quite possible that schizophrenia patients can learn the practices through Zoom, and they are learning. 20 to 25 patients in our telebatch still come and they do the practices with us from our DPNR, Psychiatric and Neuro Rehab department. So 3 precautions: do not give meditations, focus more on dynamic physical and breathing practices and loud chantings, make the patient do the practices in group so that they are able to connect with other people and with the therapist. And third thing is that we should be little more careful that we are not stopping their medication. We are not telling them to reduce the drugs. Always do it in consultation with the psychiatrists. Yes.
Okay, Dr. Bhargav, what is your experience about patients with seizure disorder? Because you have told already you have started working with patients of seizure disorder. So how is the outcome?
Sir, there is a Satyam funded study that is going on. In fact, a very wonderful study where people with refractory epilepsy who had to undergo surgery, their brain tissue that was removed during the surgery, for 3 months these people practice yoga before surgery and then for 3 months after the surgery, and the analysis of the brain tissue is going on, and the hypothesis is that yoga will enhance neurogenesis in them. But one particular thing, practically dealing with such patients, what we observed was that people who suffer from epilepsy, they have a component of cognitive, diminution. And these people require much more intense therapy and much more effort from the therapist than normal healthy people. So just a half an hour or 1 hour of yoga practice does not work for them. You have to be more intense and they require more one-on-one attention than in the group. So initially, when we wanted to deal with them in the normal way, in the interim analysis, we did not see much change. But then when the therapy was made much more intense, when these people came and they were actually asked to do one full half an hour session of pranayama separately, half an hour session of asana separately, half an hour session of chanting and meditation separately, then the impact came up. So the therapist has to put a lot more effort with epilepsy patient than the other population to produce any kind of changes. And the most useful practices that we have found that reduce the seizure index, the frequency of seizure, was the practice of slow, deep pranayama, such as the alternate nostril breathing, performed very, very slowly with slight retention of the breath after every inhalation and exhalation. So we all know that more oxygenation causes more excitation of the neurons and the carbon dioxide should be retained more. So therefore, a slight kumbhaka of say 4 seconds. In fact, we have been trying a breathing in the ratio of 1:4:2. So you breathe in for 4 seconds, hold the breath for 16 seconds, breathe out for 8 seconds. This is the kind of a breathing ratio, performing the alternate nostril breathing in that ratio, prolonging the exhalation and prolonging the time of internal retention of the breath. So these are the techniques which have been found most useful for epileptic patients.
Okay, Achha, one more question from Dr. Piyali Chaudhuri. Old people and physically disabled patients are not capable of yoga. So in that case, how mudras are help them?
Thank you, Dr. Chaudhary. In fact, one of the advantage of yoga over exercise is that yoga suits people of all the fitness levels. We have seen patients suffering from stage 4 cancer, okay, and doing yoga and improving their quality of life. There are a number of papers published in good impact journals. In fact, largest number of papers are there in people who are terminally ill, suffering from cancer and improving their quality of life with yoga. So here what is happening, the practices of yoga, as you correctly said, that we have to emphasize more on slow pranayamas, mudras, chantings, relaxation techniques, loosening of all the joints of the body with synchronization of the body, breath and mind together. So Therefore, the yogic dimensions of slow, relaxed practices which can coordinate the breath and body together should be emphasized more in this population. And also the counseling dimension of yoga is another thing which is becoming more and more popular. There are very beautiful statements that come from Bhagavad Gita and Patanjali Yoga Sutras on how to tackle old age, how to tackle death, how to prepare a person for such scenarios, because these philosophies talk about the dimensions of existence which is beyond body. So that also gives a deeper kind of insight and help to such kind of patients.
Okay, there are few questions in the chat box. Dr. Shubhamay Ghosh has asked, how will you set protocol of double-blind RCT in yoga and meditation in the field of evidence-based medicine?
Yeah, this is a challenge that we have also been facing, and when we want to publish in a good impact journal, they ask for a double blinding. In fact, most of our researchers are single blind, because a patient who is doing yoga, how will you convince the patient that he is not doing yoga or he is doing something else? So it is very difficult to do a double blind RCT. There have been one attempt by Dr. Shirley Telles where she actually taught sham yoga to patients. Patient actually did aerobic exercise, but there was no coordination of the mind, body, breath, but they were told that it is a kind of a yoga. And that was tried. We have not done that so far. We have mostly focused on single blinding where the assessor is blind, but the patient, we serve them as waitlist control, and we have not done any double blind RCT with yoga.
Another question from Professor Shubhashish Ganguly. Is there any research regarding practice of yoga in Brahma Muhurta which gives better result?
In fact, one of my PhD student is studying this wonderful topic on the morningness and eveningness of the yoga practice. Recently, a couple of papers have come up. One is on diabetes, and it was observed that people who did yoga in the evening had a better glycemic control than those who did yoga in the morning. That was the paper that was published. Similarly, there are papers on exercise where the exercise was done in the morning or evening. It was observed that if exercise is done in a morning period between 6 a.m. to 8 a.m. Duration, the quality of sleep in the night is better than those who do exercise in the evening. So in that way, more research is needed in these domains, whether performing yoga in the morning is better for a particular clinical effect than performing it in the evening. So far, I can only say that it is a very preliminary area. More research is required, but I am guiding a PhD student and trying to assess the effect on mental stress, quality of life, and their quality of sleep, and various other lifestyle factors, risk factors on corporate workers. One group is going to do yoga in the morning for a month, another group is going to do it in the evening, and then probably we will be able to comment more on these dimensions.
Okay, so there are a few questions on this morning or evening yogas that you have already answered, and the difference between yoga and exercise you have already mentioned. Now there is another question. Please suggest some postnatal yogas.
Now, especially in the current times, when the COVID pandemic is followed by a pandemic of mental health issues. At our OPD at Neurons, after the opening of the lockdown, we have seen there is a surge of patients, and here the mental health of pregnant mothers is very, very important. We all know that the period of pregnancy itself makes the ladies susceptible for depression and psychotic illnesses, and therefore here at Neurons we have been working in this area, and we have developed a yoga program which is known as mother baby yoga. Now, mother baby yoga is something which focuses basically on enhancing the connection between the mother and the born child. The yoga module is very, very beautiful. Our head of the department, Pratima Murthy madam and Dr. Geeta Desai, they have been showing interest in these areas. We have just now completed a pilot study on 15 subjects. The module actually involved focusing on some gentle warm-up practices in the beginning. It started with different kind of movements of the spine, forward bending, backward bending, side bending, and twisting, then performing loosening of all the joints of the body from the feet, toes to the head. And then the lady performed slow, gentle pranayamas, the Anulom Vilom practice for 5 minutes, and then a little more time for the humming breath, 10 minutes of Brahmari Pranayama. You know, you first 2-3 minutes, you close your eyes and produce the humming sound. Do 9 rounds like that, and then keep your hands down, touch your tongue gently to the upper palate, and then continue this humming chant. There have been research where it was observed that even ladies who had preeclampsia, 10 minutes of Brahmari helped in better control of their blood pressure levels. It also reduced their anxiety and depression. After this, what the lady does is that she goes to the baby, takes the baby in her lap, and then she moves the parts of the baby. Say, if you want to breathe in and open up the arms, breathe in, and she opens up the arms of the baby, but she synchronizes her breath with baby's movements. So opening up the arms and breathing in by the mother, closing of the arms and breathing out by the mother, and then bending the legs. You can just slowly breathe in and bend the legs, breathe out and straighten them. In the same way, a gentle movement of the joints of the baby with synchronization of the mother, the breath of the mother. So this is how we hypothesize that the mother will be able to connect to the baby better. There will be a physical touch, and when the mother does this humming chant, also she tries to connect to the baby while doing this chant and transfer those energy and vibration to the baby. At the end, we end the session by performing a relaxation technique, where the mother consciously, mindfully tries to feel the presence of the baby in her hands, feels the touch of the baby, focuses on different aspects of the baby, her face, baby's heartbeat, baby's breath, and this is how she becomes more mindful of the presence of the baby. We are going to do more research in this area. Right now, we have validated a module and tested that it is feasible. The manuscript is under review right now.
Okay. Another question from Dr. Akashdeep Dash. He's asking whether cognitive behavior therapy is gold standard of the psychotherapy field. Then how can we establish that integration of yoga with psychotherapy is having better outcome than cognitive behavior therapy? Is there any research paper supporting that? I think yes, already CBT is a mainstay of treatment. Similarly, antidepressant or anti-anxiolytic drugs and yoga also. So yoga is a additive part. It's an additive therapy. The only yoga I don't think you people also recommend. And you have already mentioned in your talk that with psychotropic drugs or with cognitive behavior therapy, yoga can be added. So, your comment any on this particular question?
Except for mild to moderate depression, where yoga as a monotherapy has been found to be effective. In all other psychiatric illnesses, I would suggest that yoga goes as an add-on to psychotherapy, CBT.
Yeah. And one interesting question from Dr. Shubhamay Ghosh is asking about PTSD, post-traumatic stress disorder in post-COVID-19. Yes, every day we are getting lots of patients with PTSD. So what is your suggestion for them?
PTSD, there are a number of researches done in US, in war veterans and others. They have found Hatha Yoga practices to be very useful. So there are very less researches on other dimensions of yoga where you do pranayama and other things. Two things are very more helpful. One is Hatha Yoga, and second is mindfulness-based stress reduction techniques. So here at Nimhans, when people come, we are prescribing them our anxiety module only. So we have validated a module in generalized anxiety disorder, and that module itself we are prescribing for people who have PTSD, and they are reporting a positive effect. But along with that, the component of yogic counseling also has been added. So yogic counseling, what it involves is, in Patanjali's Yoga Sutra, we see that there are 5 vrittis in the mind. pramana, viparyaya, vikalpa, nidra, and smriti. So yoga understand that the smriti vritti is predominant here. Smriti means that they get flashbacks of the event again and again, and that hypervigilance that takes place. So therefore, at bedtime especially, we prescribe them a guided yogic relaxation technique, which is very similar to JPMR, but it involves coordination of the breath with tightening of the muscles and relaxation of the muscles. So this technique is actually there in our Nimhan's YouTube channel. If you can search, you can put Hemant Bhargav Nimhan's YouTube. There is a guided yogic relaxation technique. So that we prescribe them, and of course the chanting of the humming breath and Om, that has a relaxing calming effect. So that is done at the bedtime, and then Hatha Yoga practices with special emphasis on the practice of Surya Namaskara that is prescribed to such patients in our clinics.
So thank you very much, Dr. Bhargav, for your detailed
Thank you, sir.
presentation. Definitely everyone has enlightened a lot about the yoga and its effect on different mental disorders. So thank you once again, and over to the organizers. Thank you.
Madam, kindly unmute yourself. And my pranams to Swami Atmapriyanandaji.
Thank you, Dr. Brahma sir and Dr. Bhargav sir for such a wonderful session. We are also very privileged to announce that Dr. Aravinda Brahma sir has kindly consented to serve this institute as a consultant psychiatrist for both UG and PG students and various research projects. We would also request Dr. Bhargav to guide us in the integration of yoga with homeopathy for better patient management and for research purpose. We will definitely keep in touch with you, sir. Thank you, sir. Thank you. We will now proceed to our second session for this today's webinar. It is our utmost privilege and honor to have with us Swami Atmapriyananda Maharaj Ji. We are extremely blessed to have Maharaj Ji as our distinguished speaker for the session to enlighten us on application of spiritual dimension of yoga in daily life for well-being. Swami Atmapriyananda Maharaj Ji is the Honorable Vice Chancellor, Executive Head of Ramakrishna Mission Vivekananda University, a multi-campus university with off-campus centers spread all over India. Maharaj Ji received his PhD from the University of Madras in theoretical physics for his work in elementary particle theory and has a number of research publications in reputed international journals. Inspired by Ramakrishna Vivekananda ideology, he joined the Ramakrishna Order of Monks in 1978 and was posted at Ramakrishna Mission Vidya Mandira, a premier college of Ramakrishna Mission at Penultimate, where he taught physics for nearly 25 years, besides serving as vice principal and principal for 19 years before taking charge as Vice Chancellor of Ramakrishna Mission Vivekananda University in July 2005. Honorable Maharaj Ji has been a pioneer educationist. He has participated in various religious and educational seminar, symposia, workshop, conferences in India and abroad. Our respected moderator for the session is Yogacharya Dr. Chanchal Royji. Yoga Charcha Dr. Chanchal Roy did PHMS in the year 1985. Engaged in Kriya Yoga practice for more than 3.5 decades. He is a disciple of world Kriya Yoga master Paramahansa Hariharananda Giriji Maharaj, who was the Grand Master of Nirvikalpa Samadhi. Yoga Charcha Chanchal Roy ji conducts regular classes, workshops, and seminars for Kriya Yoga disciples and students of India and other countries also. Being founder teacher of Hariharananda Kriya Yoga Dhyan Kendra Kolkata, he is propagating Kriya Yoga across the country of India. Not wasting much time, I would request Maharaj Ji to please enlighten us with his word. Over to Maharaj Ji, please.
Will the moderator say a few words before that, or shall I begin?
You please start up with the session, please, sir. Moderator, sir, will speak afterwards, sir.
Om yo brahmanam vidadhati purvam yo vai vedanscha prahinoti tasmai tamhadevam atma buddhi prakasham mumukshurvai sharanamaham prapadye nishkalam nishkriyam shantam niravadyam niranjanam amritasya param setum dagdhendhanamivanalam Om asato ma sadgamaya tamaso ma jyotirgamaya Om rudvayate darshanam mukham tena mahi vidityam Om Shanti Om Shakti Samudra Samudratarangam Darishita Prema Vijrumbhitarangam Samshaya Rakshasa Nasha Mahastram Yami Gurum Sharanam Bhavavaidyam Advaya Tattva Samahita Chittam Projvala Bhakti Bhatavrita Vrittam Karma Kalevaram Adhuta Cheshtam Yami Gurum Sharanam Bhavavaidyam Naradeva Deva Jaya Jaya Naradeva. The spiritual dimension of yoga is a topic of discussion. Yoga per se is a spiritual practice. Although in the modern times, yoga is also used for certain purposes which cannot be called exactly spiritual. But even then, yoga has great benefits, as we know. And the spiritual dimension of yoga, for which Patanjali wrote his magnum opus, the Patanjali Yoga Sutra, in which the purpose of yoga is the attainment of Kaivalya. Two great systems in the Indian philosophy, Bharatiya Shad-darshana, Vedanta and yoga, have greatly influenced Indian philosophical and spiritual thought and culture, and they are vibrantly practicable philosophies in the modern times by anybody. And yoga has recently gained great popularity, and we should be extremely careful about the popularization of yoga, not diluting yoga, so that yoga's pristine, original, spiritual form is preserved. All of us know about the Ashtanga Yoga, beginning with Yama Niyama, and ending in Samadhi. Samadhi is considered the very ultimate state in Vedanta. They talk about Nirvikalpa Samadhi, where the mind completely ceases. Not only the mind ceases to function, the mind is completely destroyed. It is not mano-laya, it is mano-nasha. The mind is destroyed, then how does a person actually live and breathe and function? These are very difficult questions faced by Vedantins. And ultimately, we have to rely upon the experiences of people who have actually lived this way of yoga and samadhi. Just now, we were told that the revered guru of today's moderator, Yogacharya, Dr. Kanchal Roy, and his guru, they were Nirvikalpa Samadhiman. Samadhi is a natural state of their existence. Just like we live and breathe in the ordinary world, there are some rare beings who are spiritual masters for whom Samadhi is the natural state of existence. In the modern times, we have the example of Bhagavan Ramana Maharshi in the southern part of India, who lived a state of Sahaja Samadhi. This question was posed to him: how is it that you claim that you see only Brahman, the spiritual consciousness, everywhere, but in actual life, daily life, this is also a topic of today's discussion. In daily life, what do we do? In daily life, you also make distinctions between people and people, distinction between a tree and a dog. You see differences. So, what is the meaning of the claim that you see only oneness, the one Advitiya Brahman, non-dual consciousness? His answer was very significant. He said, a jnani or a yogi par excellence, he does not experience or see anything except the supreme consciousness called Brahman. Nothing. There is no duality in his consciousness, but onlookers, outsiders, seeing the jnani function through his body mind and identifying the jnani with the functioning of his body and his mind, say that he is also seeing duality. The mind and the body of the jnani or a yogi, which are functioning according to the worldly standards of daily life of ordinary beings. But he himself, in his inner consciousness, is completely absorbed in the non-dual Brahman himself. It's a very peculiar state of existence. And the question also has been raised, in Vedanta in particular, does ignorance, ajnana, persist even after samadhi? And what is the meaning of a jivan mukta, a person who is free while living? The yogis also claim that they are totally free. After kaivalya prapti, the attainment of prakriti purusha viveka, viveka khyati, they attain dharmameka samadhi and so on. Does he have to give up his body? Does he get videha mukti? Or can he continue as a jivan mukta? There's a concept in yoga, yoga shastra, of prakriti laya purusha, prakriti laya purusha. It is not that exactly he transcends prakriti, goes beyond prakriti. He completely gets merged in prakriti and lives in that state, although he has completely conquered prakriti for the good of the world. This is very similar to the idea of Bodhisattva in Buddhism. A Bodhisattva is an awakened Buddha who, just on the point of attaining into nirvana, the complete cessation of all sorrow and the mind is overcome by Mahakaruna, great compassion, which makes him feel so much of compassion for the beings already in bondage and sorrow. So he renounces his nirvana, as it were, and does good to the world. Sarva bhuta hite rataha is a statement in the Vedanta, Bhagavad Gita, as well as in the Viveka Chudamani and many other scriptures. What is the use of your spirituality unless you can bring peace and joy and well-being to all the beings in the world? Vasantaval lokahitam charanta, Viveka Chudamani of Shankara will say, like a gentle breeze which brings so much of comfort and coolness to innumerable beings. This man of wisdom, Sthita Prajna, Jivan Mukta, a great yogi, brings so much of joy and peace to all the beings. Nirvaira sarvabhuteshu yasamameti pandava, the Bhagavad Gita says, and the Bhagavan Bhashyakara Shankaracharya and Sridhara Swami, they all say this contains the essence of all the Vedas, not only the Gita. Sarva Vedartha Sangraha Bhutam Adveshta Sarvabhutanam Maitra Karunayevacha in the Bhagavad Gita. You have no ill will, no enmity towards anybody. You have pure, infinite, all-encompassing love. So in the yoga tradition, Kaivalya Prapti may be the ultimate, but you have the idea of Prakritilina Purushas who, as it were, give up their Kaivalya for the time being to do good to the world. The spiritual dimension of yoga, as well as the Vedanta, is that you infinitely expand, encompass the whole universe in your heart, and in the highest sense, every eye which sees is your eye, every ear that hears is your ear, every mind which sings is your mind, every pair of feet which walk is your feet. Sarvata paripadam tat sarvatokshishiro mukham sarvata shutimalloke sarvam avritta tishtati. A yogi feels the pain of others as his own. The Bhagavad Gita emphasizes yoga as samatva, samatvam yoga uchyate. The spiritual dimension of yoga is that you feel equality, equanimity. Sukha dukkhe same kritva labha labho jaya jayo tato yutha yujyasva nevam papam avapsyasi. The Bhagavad Gita, sukha dukkha, pain and pleasure, labha alabha, gain and loss, jaya ajaya, loss or victory. Treat all of them equally. What does that mean? That means all that happens in the world are in space, time, and causation. They come and go. And the Buddha's Kshanika Vijnana, for example, says everything is temporary, transitory. The yogi does not get attached to any event happening in space-time. Padmabhadra, the Bhagavad Gita, just like a water and a lotus leaf, it simply gets dropped out. You do everything, you go through everything, but don't excessively get attached. Abhinivesha is one of the kleshas. What creates a problem is your attachment to it. Smriti and Smriti Vibhrama, the Yoga Sutra, as well as the Bhagavad Gita, Vedanta also talks about it. Smriti Brahmashad Buddhinasha Buddhinashat Pranashyati. Smriti Parishuddhi is a statement in the Yoga Sutra, and Bhava Samshuddhi is mentioned in the Bhagavad Gita in the Vedanta. So the Shuddhi Karana is the most important aspect of daily life. How can you live happily? How can you ensure a well-being in daily life? Be pure, absolutely, unconditionally pure to the marrow bone of your existence. Purity of mind, purity of body, purity of senses. Go on purifying yourself. This is a fundamental lesson in yoga as well as Vedanta in all the systems of Bharatiya Darshana and religious practice and of all the religions. Christianity talks about purgation. You purge yourself of all the sins, the accumulated evil tendencies. These kleshas are constantly there with you because you accumulated them through karma over millions of lives. Clean yourself, clean yourself, clean yourself. The Mahanarayana Upanishad talks about this in a dramatic way in a series, step after step. These are chanted at the time of sannyasa, the Viraja Homa mantras in sannyasa. Shuddhyantam Jyotiraham Viraja Vipapma Bhuya Sagdaswaha. Shuddhyantam. At every point is a Shuddhyantam. Shabda Svarsha Rupa Rasagandhame Shuddhyantam Jyotiraham Viraja Vipapma Bhuya Sagdaswaha. Manova Kaya Karamani Me Shuddhyantam Jyotiraham Viraja Vipapma Bhuya Sagdaswaha, and so on. Annamaya, Pranamaya, Manomaya, Vijnanamaya, Anandamaya. Layer after layer, your mind, the subtle part of your mind, go on cleansing, go on cleansing. The whole attempt in yoga and Vedanta is to go through a serious process of cleansing. Start from your body and go, your mind, your senses, and ultimately your egoism, the asmita. The last obstacle in our daily life as well as in spiritual life is the aham. It's a very peculiar entity, the aham, and what is it? Nobody knows. If we chase aham and said, what are you? It can never be found. It's a kind of a ghost. It exists but doesn't exist. Just like in physics and in science we say, the image that you see in the mirror, is it a real or unreal? You see it. You laugh, the image laughs. You cry, the image cries. You are angry and the image is angry. So it appears to be just like you. How can it is unreal? Then the question is raised, if it is real, can you photograph it? Come on, show me a photograph of your image in the mirror. You can't photograph it. And you move away from the mirror, the image also goes. So what kind of image is that? If it is real, it has to exist. Even if you move away, it has to exist yesterday, today, and tomorrow. But this is image which you see in the mirror is conditional, dependent upon your standing in front of the mirror. So science gives a beautiful name for it. It is not a real image, it is a virtual image. Virtual is a very beautiful word which is used these days. Now we are holding a meeting, we are holding a conference, and the notice says, we will have a virtual conference, virtual meet. That has become extremely common. It's called the new normal in the Corona days. A virtual meet, is it absolutely unreal? No, it is real. I am seeing all of you, you are smiling, I am smiling, I am talking, you are listening. All this is happening. It is a It is real, but in a sense it is real, in a sense it is not real. So this kind of quasi-reality, which is in between reality and unreality, existence and non-existence, and a curious mixture of these two is called virtuality. And the Vedanta calls it Maya. Maya is not completely unreal. It has been wrongly translated in English as unreal. It is neither real nor unreal, but both real and unreal. And therefore, Maya is correctly translatable as virtual. This is a new word which has emerged thanks to the COVID-19 pandemic. And everybody is talking about virtual reality, virtual conference. And your yoga and Vedanta say your whole life itself is virtual. Why don't you understand that? That you think you have a real body, you have a real mind, but ultimately the whole thing is only virtual. Yoga analyzes the mind, the nature of the mind. What is the nature of the mind? What are the vrittis of the mind? Vritti is a mind which is modified into thoughts. The simple translation of vritti is thought. Now, what is thought? Thought is a process which occurs in the mind. Now, the question is the mind apart from the thought? If you say thoughts arise in the mind, then when the thoughts completely cease, does the mind exist? These are questions, deeper questions of Vedanta and Yoga. And these two systems have different takes on this. Yoga will say is the vritti of the chitta, the mind should be restrained. The famous definition, chitta yoga's chitta vritti nirodha. There's a problem in this definition, which has been pointed out by Vedanta. Chitta vritti nirodha, who does the nirodha? I do the nirodha. Who are you? Are you the mind? Are you the thoughts? Are you apart from it? I is the thinker who thinks the thoughts. Is the thinker apart from thoughts? Or is it that the thought projects the thinker? In the extreme Advaitic position, they will say thinker is an unreal object which is projected by thought. And they will go to the extreme point when all the outside objects are also projections of your own thought. Manaspandana. There is no object out there except those projected by your own thoughts. These are extreme positions. So in daily life, what do we do? Apart from all this philosophy. So when the mind becomes restless, disturbed, just sit calmly and ask yourself, what is the thought that is happening now? And will this thought remain forever tomorrow or day after? If you say the answer is yes, it is troubling me, what about the thoughts which troubled you yesterday but no longer today? So one way of looking at it is, rather than trying to do chittavritti nirodha, constantly attempting chittavritti nirodha and pushing the mind and trying to make it calm, and you feel so tired and you sleep off. So laya is a state to which control of vikshepa and shepa take you. Vikshepa is modification, disturbance in the mind. You try to control it, the mind sleeps off. This is the danger in daily life. Those who practice yoga and then the dhyana. Dhyana is the penultimate state of samadhi. Remember that. Unfortunately, we begin with asana, pranayama, and go to dhyana, and that's it. We have reduced the whole of the practice of Ashtanga Yoga to 3. asana, pranayama, dhyana. Things are not that easy. A lot of purifications to take place through yama niyama. Then pranayama is not only control of breath. Breath is a manifestation of prana. Prana is a remarkable concept in Indian philosophy. Vedanta has a huge discussion on that. Of course, the Yoga Sutra and the Sankhya, Tantras. In fact, prana is identified with Hiranyagarbha, the cosmic mind, which is identified with Saguna Brahman. And prana is identified with Shakti in Tantra as a Kali, Durga. Prana is a remarkable discovery of our ancient rishis, which is the link between the Jada and Chaitanya. It's a small thing if you can remember. A simple question can be asked from daily life. Suppose you eat your food. I enjoyed my food. I was so happy eating. Who is eating the food? Is it the body? The body is the Jada Padartha, inert object. If you say the body is eating, when you're asleep, somebody puts food into you, you don't even know. Unconsciously, sometimes the body may even consume that food if it is liquid. But the body cannot eat the food because the Jada, it is inert. Consciousness, Chaitanya cannot eat any food because it is Nityashuddha Swabhava, it is completely unrelated, untouched by anything. So who eats food? So they discovered a wonderful formula. There is a link called prana. Nowadays we talk about link everywhere. Every day we attend so many online meetings now for the past more than a year. And we say, can you send me the Google Meet link? So link is that which connects you to the meeting. So the prana is the link which connects you to the world and the link between Jada and Chaitanya. Inert and conscious. So a Hindu child is taught as soon as he sits before the food, worship the food, bow down before food, is Anna is Brahman. Then Pranaya Swaha, Apanaya Swaha, Jnanaya Swaha, Udanaya Swaha, Samanaya Swaha, Brahmane Swaha, Om Brahmarpanam Brahmahavir Brahmagna Brahmanahutam Brahmaiva Dena Gantavyam Brahmakarma Samadhina. The Bhagavad Gita shloka. So I offer this to Prana, Apana, Vyana, Udana, Samana, the Pancha Pranas. Prana has different manifestations and so many other manifestations are also mentioned. The play of Vayu in your body is a manifestation of prana which you visibly see. Why is prana so important in daily life? Why pranayama is emphasized? Pranayama has to be very carefully done, not by seeing the books and following the television videos. It's a very, very serious exercise to be performed in the presence of an illumined guru, Sadguru, who will teach you carefully and extremely cautiously. If you can bypass Kumbhaka, Arechaka and Puraka can be performed, which is called Nadi Shuddhi. You exhale and inhale rhythmically, even that is good enough. But to practice Kumbhaka, one has to be extremely careful. And what is the care? Purity and brahmacharya. If you do not observe strict purity and excessively practice Kumbhaka, the yogi teachers have warned us that you may end up by having your mind and brain deranged. Be very careful. Limited Kumbhaka may be performed, but extraordinary purity is required. See, yoga is not an easy affair. We say yoga is everywhere. East, west, north, south, Westerners are jumping with yoga. Some kind of hatha yoga they are practicing, even that is useful. But don't reduce yoga to mere physical exercises. Physical exercises pertain to the bone and the muscle. What is the difference between the hatha yoga exercises and the physical exercises? Physical exercises tackle the bone and the muscle, but hatha yoga exercises tackle the nervous system. This is a very, very important difference. The nerve centers in the body, they are controlling the whole body and the mind, and the nerves can be manipulated, can be controlled through hatha yoga. So many points are mentioned in the body. There are highly esoteric and secret knowledge which has to be learned at the feet of a great illumined guru. Things cannot be learned. Nowadays, unfortunately or fortunately, YouTube has become a great guru. Everybody goes to the YouTube. Oh, I'm practicing yoga. Who is teaching you? No, there are so many videos available. Be very careful. That's the warning. And so many gurus, fake gurus, unfortunately, they have learned from the video and then they become gurus. How many years of practice people do? Today's moderator, Yogacharya ji, Dr. Chanchal Roy, was mentioned for 35 years he has been practicing. It's not easy, particularly from the West. We have learned this. Quickly you should do something. Fast results we want. There is a very interesting joke. One of our very senior Swamijis in Hollywood, he himself was a disciple of Ramakrishna Paramahamsa. He was a very saintly soul. So many Americans used to come to him for mantra diksha and for spiritual advice and so on. So there was a disciple who took mantra diksha from him. He was practicing. And after 3 years, he became restless. He calls up the Swami. The Swami told me very humorously, he calls up the Swami. Swami, your mantra is not working. Would you like to change it? Just like the doctor says, you take this medicine for 3 days. If you don't get an improvement, I will change the medicine. Would you like to change it? And the Swami said, I see, how is it possible? This is a Siddha mantra which we received in the Parampara. You have to patiently practice it year after year. It's not easy. You see, how long? He said, I have been practicing for 44 years. Wow, Swami, 44 years. I will find some other guru. He walked away to some other guru who was promising him Nirvikalpa Samadhi in 3 days. These advertisements, it pains me so much to see bliss, nirvana in 5 days. A quick workshop, pay so many dollars, and you purchase nirvana. Even then, some good is happening. Let us take it in a positive sense. Swalpamapyasya dharmasya trayate mahudo bhayat. Even a small practice of this yoga leads you to great results, Bhagavan says, but you should be genuine. Don't commercialize it. Commercialization is called virgina. A guru has to be avrajina, sinless, because selling knowledge for selfish ends is a great sin. So this prana, which we are talking about, is that which moves your body and the muscles and senses, blood circulation and so on, in the microcosm, in the vyashti, and that is the prana which is moving the sun and the moon and the stars and the nebulae and all the macrocosmic celestial bodies. And wherever there is force and energy, it is a play of prana. If you focus on prana, how prana can be regulated. What they discovered, the ancients, was when the prana is restless, the mind is restless and vice versa. Kama, Krodha, Lobha, Moha, Mada, Matsarya, the 6 big viruses. Now, virus is everywhere, coronavirus. The terrible viruses we found out long ago, and they mutate. Now we have a Delta variant, we have a Delta plus variant. It is also discovered earlier, Kama virus, when it comes to you, then try to tackle it. There is a variant of that Kama called Krodha. Krodha is a variant, Delta variant of the Kama. Kamat Krodho Vijayate. Krodha Bhavata Sammoha, Sammoha Smriti Vibhramaha, Smriti Brahmashad Buddhinasha, Buddhinashad Pranashyati, Bhagavad Gita. So it is a continuously, there is a variant happening, Delta variant, Delta plus variant. Now they say in Peru, there is a Lambda variant of coronavirus. They are going to exhaust the entire Greek alphabet. So this is a virus which affects you. Mind is affected. You become terribly upset, restless, angry. Calm the mind. How do you calm it? Then they discovered the prana immediately gets dislocated. There's an uneven movement of prana as seen by the breath. If you get angry, like dogs, human beings become so restless, they can't breathe. So they said, when you see these impulses of kama krodha coming in the mind getting restless, the prana is thrown out of gear. So why don't you try the opposite? Bring the prana in harmony so that the mind will slowly get into harmonious mode. That's one practice. In daily living, try to practice calm, rhythmic breathing. That's very easy to practice. We need not even go to Kumbhaka. Simple, calm, rhythmic breathing, deep breathing. Suppose in the midst of a conference, suppose you are working on the computer, suppose sometimes you get telephone calls which are very disturbing. You put down the call and you feel very much disturbed. Sit quiet. Have deep breathing, which slowly calms the mind to some extent. And yogi is an advanced stage, they say. You don't even have to touch the nostrils. You touch one nostril and do Rechaka, then hold both the nostrils, Kumbhaka, and the other nostril, you do Rechaka. We know the process. So they say you don't have to even touch. By your constant practice, Kumbhaka can be automatically achieved even without any physically touching the nostril. The prana can be restrained within through Kumbhaka, through long years of dedicated practice, and again I emphasize through purity and brahmacharya. Brahmacharya is nothing very strange. It is only control of the senses. Shabda, Sparsha, Rupa, Rasa, Gandha, which wants to go and experience the outside objects, you control them, you try to restrain them as much as possible. Self-restraint. There is no vikalpa, the alternative to this. Many people now take to yoga and Vedanta and spiritual practices. They say, I can't practice self-control, but with lack of self-control, can I manage this yoga? No, everything is managing. Management is everywhere. Once upon a time, our yogis and great spiritual masters said, control your anger, niyantrana. You should control yourself by yourself. Uddharayad atmanatmanam natmanam avasadayed and so on. Indriyan indriyarthe bhistasya prajna pratishita in the Bhagavad Gita. Now they say it is no longer control of anger. You manage your anger. You are angry, be angry, no harm. So manage anger. Management of anger What does it mean? You can be angry, but somehow you pretend as if you are not angry. You put on a bright face, but inwardly you're full of anger and animosity. You put on a broad face, how are you? Thank you. Well, the kind of hypocrisy which we see in modern society. So, if you can regulate your prana with purity, you will be able to calm your mind first. When the mind is calmed, then your senses also come under control. Now, what is the problem here in daily life practice? The mind has to be restrained, controlled. Indriyani indriyarthebhya tasya prajna pratisthita. But when the senses are turbulent, the mind becomes restless. I calmly meditate. Suddenly I see a picture in the television. All my old memories wake up and my mind is full of lust and anger and greed and so on. I try to be calm. Suddenly somebody insults me, somebody says something to me. It enters my ear and my mind and I get terribly angry. So when the senses are turbulent, then they hijack the mind. This is Bhagavad Gita. Indriyani pramathini haranti prasabham manaha. Prasabham, forcefully, all the indriyas hijack the mind. Now, you are supposed to control the senses. By who? By what? By the mind. Where is the mind? Already hijacked. Then what do? You are going round and round in a vicious circle. Bhagavad Gita, 2nd chapter. Vishaya vinivartante niraharaskadehina rasavarjam rasopyasya param drishva nivartate yatato hyapi kaunteya purushasya vipastitaha indriyani pramathini haranti prasabam manaha tani sarvani sanyamya yukta asita matparaha vashehi yasyendriyani tasya prajna pratisthita. Very enigmatic verses. Vashehi yasyendriyani tasya prajna pratisthita. The mind senses have to be controlled. By what? By the mind. Where is the mind? Already hijacked. Indriyani pramathini harate prasabam manaha. Tani sarvani sanyamya. Control the senses. What does it mean? It's a vicious circle. The mind has to be controlled. For which senses have to be controlled. When the senses are restless, they hijack the mind. How can a hijacked mind, restless mind, control the senses? Go round and round. Bhagavan Ramanujacharya, the famous Vishishtadvaita exponent, raises this question in his Gita Bhashya commentary. He says, what a peculiar statement. Mind and senses are depending on one another and one trying to control the other, but how can you do it? It's going round and round. Then he says the clue to this is in Yukta Asita Matparaha. This occurs in the Gita more than once. Yukta Asita Matparaha. Matparaha, Bhagavan says, knowing me to be the supreme, Yukta, so yoga connect to me. Yujidatu Kta, Yukta, be united to me, be attached to me, be yoked to me, be connected to me. So Yukta occurs so many places in the Bhagavad Gita. Yukta, Satata Yukta, always connected. Nitya Yukta, ever connected. Yukta Tama, supremely connected. What we now call connectivity. Yoga is nothing but 24/7 Wi-Fi connectivity to the Supreme Being. You call it Lord, you call it Bhagavan, you call it Atman, you call it your own higher self or whatever. Mukta asita matparaha. Ramanuja says, when you connect to the Lord, I'm restless, I can't control my mind. And the mind has to be controlled by the senses. Senses cannot be controlled. So I'm in a total mess. Then Bhagavan says, Yukta asita matparaha. Ramanuja interprets beautifully the same. Connect to the Lord. Oh Lord, I cannot control my mind. You please help me. When you pray to Him, surrender to Him, He gives you a quantum of energy. Dadami buddhi yogam tam yedamam upayantite. 10th chapter of the Bhagavad Gita. You just think of me, that's all. Sing my glory, talk about me to everybody. Madchitta madgata prana bodhayanta parasparam kathayantas chamam nityam tushyanti charamanti cha. My devotees delight and intensely happy. They are absorbed in me, my thought, and all their prana and all their energies are deposited in me. And they talk to me, talk about me to one another so happily. What do I do to them? Dadami buddhi yogam tam yena mam upayantite. Desham satata yuktanam, those who are yogis, constantly connected to me, yukta, I give them buddhi yoga, through which they come to me. So this is one method, daily life, which is endorsed by Patanjali. Remember, Patanjali was a great jnani, of course a yogi and a bhakta. We miss this aspect in Patanjali Yoga Sutra. Ishvara pranidhanatva. This is a sutra which we rarely utter, think about, or practice. So many alternatives are given there by Patanjali, the great Rishi, Maharshi. And he says there is one simple method. If we can't do all this, I'll give a simple method. Go and surrender to God. This can be practiced. You go to God and say, oh God, please calm my mind. Please restrain my senses. Please give me the capacity and the energy to be able to control my mind and senses. And the Lord says, oh, you want it? Take it. And Patanjali says about Samadhi. How do you attain Samadhi? Ishvara pranidhanatva. Through Ishvara pranidhana, you can attain Samadhi. I always think it's the easiest way to do it. Why do you go through all these complicated exercises? Yamaniyama, asana, pranayama, pratyahara, dharana, dhyana, and then go to Samadhi. You straight away go to God, with tears in your mind, with a pure heart, with intense longing and feeling and yearning for God. You say, oh God, I'm trying for Samadhi, I'm not able to get it. I'm a very ordinary being. Please give me Samadhi. The infinitely compassionate Lord says, all right, hey, Samadhi, give him, take it. What a simple method. In daily life, again I emphasize the yogic way of living, have some faith in the infinite supreme God. Nowadays, there is a fashion not to believe in God. Among friends, if you say you believe in God, you are supposed to be unscientific, irrational. What is your reason? I always see now the little tiniest of the tiny virus called the coronavirus, completely shaken and pulverized to smithereens the arrogance of knowledge of the entire humanity. Nobel laureates, biologists and virologists, immunologists all over the world are completely flat. The virus says, come on, this challenge, you meet this challenge. And with great difficulty, so much money was spent, millions of dollars and so many laboratories. Now we have a vaccine. You stupid man. By the time you come up with a vaccine, the virus is already mutated to something else. Now everybody says, we can't understand the functioning of this virus, the nature of this virus. Then why do you claim your knowledge in biology, in virology? This virus has already become a Delta variant. By the time you catch the Delta, it has become Delta plus. It is like Mahishasura. In the Puranas, Mahishasura, when he was killed by Durga, he suddenly took the form of an elephant. When Durga killed the elephant, he became a lion. When Durga killed a lion, became a Khadgapani, person with a sword. Constantly changing, mutating. And it's a combination of Mahishasura and Raktavija, mutating and multiplying. Within microseconds, Raktavija multiplied to millions of Raktavijas. This dangerous virus is a combination of Raktavija and Mahishasura. Only Durga can actually kill it. So you pray because you have no choice. When you are pushed to a corner, you raise your heart in prayer and pray to something which you do not know what it is, some higher power which will give you strength. Try this method. You have to believe in something which is permanent. What is the scientific principle? If everything in the world is changing, you can't put your trust in anything. You go back home, you find your home is not there, it is moved somewhere else. You can't depend on your body, your mind, your senses, your children, your wife, your bank balance, and anything. Just the virus has shown. Some years ago, even a decade ago, we used to hear books have come out, 2020, Vision India, Vision 2020. India and the world are going to change. 2020, something is big is going to happen. What happened in 2020? So don't dream big. Your little intellect is nothing before the vast universe of Prakriti. So this Prakriti is also identified with Brahman in Tantras, in Vedanta also, called Brahma Shakti. It's called Maya, it is called Avyakta, it is Prakriti, it is Brahma Shakti, it is Durga or Kali. So pray to that higher power, Ishvara Pranidhanatva, and you get power, you get strength from that. So lead a life of deep prayer to any kind of entity that you call it. And scientists also pray. I will end with this quote by Einstein, one of the greatest scientists ever produced by humanity. He said, "My religion consists of a humble adoration of an illimitable intelligence which our dull faculties can comprehend only in the most primitive form." He also said, the most sublime and the most profound emotion one can feel is the sensation of the mystical. It is truly the source of all science. He who is a stranger to this emotion, who can no longer stand and wonder and wrap awe, is as good as dead. To know what is impenetrable really exists, manifesting itself as the highest wisdom and the most radiant beauty, which our dull faculties can comprehend only in the most primitive form. This feeling is the essence of religion. This cosmic, religious, and mystical consciousness is truly the mainspring of all scientific research. In daily life, let us have a combination, as Swami Vivekananda said. You pray with devotion to the Supreme Being, and you meditate, calm your mind through yoga, and you do vichara in Jnana Yoga, discrimination, the discernment and viveka between the real and the unreal, between the permanent and the impermanent, nitya, anitya, vastu, viveka and vairagya and Jnana Yoga, and unselfishly serve everybody through Karma Yoga. Jnana, Bhakti, Karma, and Yoga harmoniously combined will lead to the highest results. This is Swami Vivekananda's teaching in the modern times, synthesis of the 4 yogas, which is the recipe in the modern times for the attainment of well-being, wellness for everybody. Thank you so much. Om Shanti 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 Harihi Om Tat Sat Shri Rama Krishna Pranamastu.
Words fall short to express our gratitude for your kind presence. an enlightening talk on the topic of spiritual dimension of yoga and daily life. May I now request Yogacharya Dr. Chanchal Rai, who is also an alumnus of this institute, DND Homeopathic Medical College, second batch, to please say something as a moderator. Over to you, Dr. Chanchal, sir.
Yes. I bow to the one Heavenly Father, whose life force and energy is still flowing through us, and He has kept us alive to talk. I bow to all the saints and sages of all religion. I bow to the lineage of my masters and bow to the principal of my college. I bow to my Gurudev Paramahansa Harinanda Giriji Maharaj, who has taught very kindly has taught me the Kriya Yoga. I bow to Swami Atma Priyanandaji. And I finally bow to you all, because you all are God in human being and human being in God. Some of you have understood this, that you are God in human being. Someone has not, and someone is trying to understand this. Apart from our daily, everyday life, every tough life, we have a quest in our life that what is the purpose of my earth journey? Only to earn, eat, have a sleep, have a car, have a flat only. So what is the vacuum within me? And that is the eternal quest. And this eternal quest will lead you to a spirituality in everyday life. Spirit means that one which one could not be seen, but could be perceived. Homeopaths are very lucky because Samuel Hahnemann has given the theory of life force, the vital force, the spirit-like life force, and the spirit-like medicine that acts on a spirit-like vital force. We are lucky enough. So, Swamiji has given the entire encyclopedia of modern yoga. If I am to moderate this, it will take another 1 hour time. Pranam Swamiji. So, I will rather go in few important steps of daily life by which we can be enlightened with godlyhood. Primarily, in Mahanirvan Tantra, it has been said, Uttama Brahma Sadbhava, Dhyana Bhavastu Mattama, Stutir Japaha Adhama Bhava, Bahir Puja Adhamadhama. The spiritual life that starts in a human being, it starts with the primary school, that is Bahir Puja. First we go to Mandir, Masjid, church, pray for us, ask for something, some material gain to the God. May we get, may we not get. We are not satisfied, then we think what to do. We go to a guru. He says some mantra in our ear. Yes, better you chant it. We'll go to guru. We chant it, Hare Krishna, Hare Krishna, Hare Krishna, Hare Krishna, even at playing microphones so that people can hear. As if God is deaf, he cannot learn, he cannot listen. So chanting mantras is the secondary school. After chanting, we will not get any result. May we get little result, because in mantra yoga it's called Manana Trayatiti mantra. One which can give, you can give rise to your above your mind is called mantra. So even we are not satisfied with mantra. Then we try to do some meditation without knowing the perfect technique. That is the graduation level of spirituality we try to practice. And finally, the masters and above masters level of spiritual practice is Uttama Brahma Sadbhava, that is yoga, which Swamiji has given the 4 steps of yoga, like Karma Yoga, Jnana Yoga, Bhakti Yoga, and Raj Yoga. Swamiji said that it's very tough. It's very tough to learn yoga. Yes, it is tough. How long? So long it is tough, so long as you do not have your determination. Swami Vivekananda has said Where there is a will, there is a way. If you have that strong will, you can learn it. So before you start practice yoga, Raj Yoga, you have that strong will. Unless you have that strong will, you cannot learn this. That is why in Shastra it has been called Atma Kripa Hi Kevalam. God, Guru has come and given you everything. Well, you get Samadhi. Even then you won't get it until and unless you have a will of your own that yes, I want to have it. Now, see, mind is a very good servant, but is a very bad master. Rishi Patanjali, in his time, because yoga was very tough before Rishi Patanjali, you know, Ved has 4 parts. That is, there is a 4 parts. There is Samhita, Brahman, Aranyak, and Upanishad. Upanishad is the cream part of Ved, where every synthesized knowledge has been given. It is also called Vedanta. From there, the human race started the process of yoga. It is beyond Vedic age. So people were enlightened with the practice of breath. My master, Harihan, used to say, breath control is self-control, breath mastery is self-mastery, and breathlessness is deathlessness. Being alive, you know how to die, that is Samadhi. You get united with the God. It is the easiest job in the human life, and that is the minimum most quality that a human being has to attain to enter into the school of spirituality. In Patanjali's Yoga Sutra, Yam, Niyam, Asana, Pranayama, Pratyahara, Dharana, Dhyana, and Samadhi, these 8 folds has been given. In Yam, it has been told, Ahimsa, Satya, Brahmacharya, Asteya, Aparigraha. That is non-violence, non-stealing, celibacy, not to look after others' property, etc., etc. These are the negative qualities has to be renounced. In Niyam, it has been said, Satya, Santosh, Tapa, Shraddha, Ishwar, Pranidhanani. So these are also some tough steps. Then comes Asana. Asana means where you sit, whether it's tranquil or not, whether it's comfortable or not. It should be an internal asana and both the external asana. Then you start pranayama. After doing pranayama, then comes dharana, dhyan, pratyahara, and samadhi. So, if I ask someone that you leave violence from today, you start celibacy from today, don't steal others' properties. Would anybody learn this? Would anybody practice this? No, none will practice this. Because habit is the second nature of a human being. Then if I say, yes, you earn 20 rupees a day, be contented with that. No, he won't be. If I say you start practicing, you practicing yoga and you be enlightened, no, he won't be because he doesn't know the technique. So, when people has an eternal quest, our human brain is one of the strongest instrument in the world. Swamiji ended with this human brain and laboratory and science. See, human brain is the biggest laboratory in the world, in the universe, because this brain has created everything, whether it is a supercomputer, whether it's a spacecraft, whether it is a research for COVID virus, whatever it is, this human brain was made. And one who exercises that, he's a scientist. Rather, we call it saint. Saint is a scientist. And Indian saints were the real scientists forever. And India is ever specialized in the science of soul culture for the time immemorial. That is the biggest resources of India and Bharatvarsha. Now, coming to the point of daily spirituality. What is spirit? Spirit is that is which we cannot see, but we can feel. The formless within the form. If my spirit leaves me right this moment, Chanchala is dead. He can't speak anymore. So, to know him, the formless that is sitting within me, very lovingly, very compassionately. He loves me. What is his manifestation? His manifestation is breath. Why? Because, see, a very simple solution. If you are angry in your home, you do not eat today, you won't die. Even you do not eat for 15 days, you won't die. If you are angry with your wife, you do not drink water for 3 days, 4 days, 7 days, you won't die. But if you are angry with Swamiji, I won't take any more inhalation today. You cannot do that. Because the Creator has not given you the control over your breath. So after 30 seconds, you have to open your breath again. You can't do it forcefully. So who is inhaling for you sitting within you? It is your soul, your Atma, yourself, your God, your vital force. He is inhaling. He is doing it compassionately, lovingly, without he hasn't asked anything for you. Maybe your hospital has asked for you ventilation charges and oxygen charges, lakhs of rupees. The God has not asked you for any single money for which he has given the oxygen till your life. He hasn't asked for any money. What he has asked for you, he has asked only for love. If you love God, if you love yourself, then you can be a realized person. Dhai akshar jo prem ko pare, pandit sohi. Now comes the point, how to reach that point. Yes, Swamiji is very much correct. We have to go to a realized master. Who is a realized master? Who is a Sadguru? Sadguru is not a branding. Sadguru is the highest quality of spirituality. Who himself has done that, seen what it is real, what really it is, who has unveiled the secrets of the nature, and he has encountered Pratyaksha darshan with the Creator, who has seen the Creator, who has realized the Creator, and has come back and given the techniques to learn. He is a Sadguru. So when you go to after having this quest, who am I? How to reveal myself? You go to a realized master. The realized master teaches you some secret techniques. This technique is nothing but the intricate process of pranayama which Swamiji was telling. The pranayama, now the people do, this is only a hot choke pranayama. That only can give you a relief to your sinuses, your polyp, maybe upper respiratory tract, maybe to little bit to a COPD. Nothing beyond that. It never make you realize. To make you realize, you have to go into real essence of pranayama. See, we all are being run by our indriyas. We want to eat, want to enjoy, want to this and that always. Indriyana mananathasta maruto. Who is the Lord of your indriyas? Your Marut, that is your Vayu. Who is the Lord of your Vayu? Your mind. Who is the Lord of your mind? Your Atma or your Prana. And Prana is always still. So you have to go back to Prana. Kriya Yoga is based on the principle of breath. Kriya Yoga is based on the principle of short breath. Kriya Yoga is based on the principle of shortest breath, as subtle as that is could be. So, in Gita it has been said, apane juhuti pranam, pranapanam tatha pare prane apane goti yuddha pranayam parayana. So there is a process which Sadguru teaches, there is a Gurumukhi Vidya. It cannot be told in open forum, nor in YouTube. One who knows it, he'll never expose it in the YouTube or in social media, neither on TV. I won't tell you right now. So thing is that there is a very intricate process, but it is very easy. Believe me, it's a very easy. People think it tough, but it is really easy. One thing you have to have, that is your wish to learn it, determination to learn it, your love for the subject. So there are 5 prans, though there are 50 prans, there are 5 prans, 5 vayus, rather, pran, apan, udan, shoman, udan, ban. The apan vayu remains in the lower part of the body, the pran vayu remains in the upper part of the body, shoman in the navel region, ban in everywhere, and udan in the Brahma, above the Vishuddha chakra. So when Guru teaches how to And there are 7 fires always on in the 7 chakras: Muladhara, Shadishtan, Manipur, Anahata, Vishuddha, Agga, and Sahasrara. These are the prime neural nodal junctions in the spinal cord. And spinal cord is nothing but a protruded hanging portion of brain itself. And this human brain is so capable that it can go beyond its existence, provided you know the technique. Yoga karmashu kaushalam. You have to know the perfect technique of yoga. When you learn the perfect technique of yoga, it becomes easy for you. When you are not a doctor, you used to think how to stitch, how to give injection, how to do an appendicectomy. Once you learn, while talking with the doctors, you can operate the appendix. It's as good as that when you learn that. So apane juhuti pranam, the 7 fires that you have, the Dakshina Agni, Grihapati Agni, Vaishana Agni, Shambhodbhava Agni, Brahma Agni, Vishnu Agni, all the 7 Agnis is there. And these are being ablated by oxygen every moment. Unless we ablate those fires with oxygen every moment, it won't be alive. It will die immediately. So the Pranvayu is ablating in the Apanvayu, and at stage Apanvayu is ablating in the Pranvayu. So there is a constant process of going up and down. That is Purak, Antarkumbhak, Rechak, Bohirkumbhak. So this process is continuously going on, but you must know how to and where to and wherein we have to channelize that Pranvayu. That is within your Sushumna. That is Sushumna with a very, very subtle core within the spinal cord. That is called Sushumna. And within Sushumna there is Chitra, Vajra, and Brahmanari. And this Brahmanari will lead you to the Brahma. That is the God is sitting here. Your God is sitting here with all quality of God. Because at the end, God created man and woman with his own image. And he breathed his air of life into the nostril of man. And man was alive. But he has given you 51 types of breath. And these 50 types of breath will take you away from Godhood in the mundane world. But one simple breath, Udan Bhai has given within, that will take you to the world of spirituality. Unless you can catch hold of that Udan Bhai, the simple shortest breath, by grace of your Sadguru, you can never be realized. All else will be a theoretical matter, never a practical matter. So Kriya Yoga, it's a matter of absolute practical matter. You have practice. Without practice, you cannot do it. Practice makes a man perfect. Banat banja. You can. Everybody has that potentiality. Swami Vivekananda say, every soul is potentially divine. Now, with the help of this process of pranayama, Papani Goti Ruddha, you don't have to hold your breath forcefully. It will be hold of its own. The breath will come to a cessation. You will attain a breathlessness stage within you. The breath will be within you. And as soon as the breath is no more, there is no breath condition. You will be absolutely tranquil, calm, and calmliness is godliness. You be united with the God. There are 6 steps and 6 ways of pranayama. Now, Yam Niyam Asana Pranayama. Pranayama is the pivoting point where you to start. Now, when you practice pranayama again and again, by the correct teaching of your Sadguru, what happens? By default, your Yam Niyam Asana starts. And when again you practice pranayama, Uttar Dharana Dhyan starts. So this is the pivoting point. Pranayama is the main thing, the scientific control, the scientific practice of breath. That is being taught by Kriya Yoga. That is the oldest science in the world. Once who has attained the stage of Samadhi, there are 7 steps of Samadhi has been told in Kriya Yoga. And I'll mention in a nutshell so that you'll get interest into that. Once you know thyself, presume not to scan God. The proper study of mankind is man. What is the proper study of mankind? Knowing thyself. You have to know yourself. Amar apnake ji jana amar furalo na. You have to know yourself. Once you know the interest system done by who has been created by the Creator. God was alone and he was not feeling well. So he suddenly thought he did the econ. He saw that I want to be many and enjoy. Ekasham bahu prajayati. I want to be many and I want to enjoy. And he created himself like Swamiji, like Dr. Shubhamay Ghosh, Ganguly, etc., etc., etc. He created all. And he is enjoying through the breath. One common thing every living creature in the world does, that is breath. Breath is the life, breath is the God. And he has entered as life and he himself is enjoying, whether it's a good word or it's a bad word. He is enjoying. So in these sequences, when once we learn the process of breathing and when the breath is controlled, it is absolutely cool and calm, then we get united with the God. That is the stage of Samadhi. In first Kriya Pranayam, there are 6 steps of Kriya Yoga. In first step of Kriya Yoga, a person, a practitioner, attains a Samadhi called Shubhecha Samadhi. He feels, when his breath is controlled, he feels, yes, there is a presence of God and I can feel him. Then comes Vichorani. In the second part of there is another special pranayam. By means of that pranayam, he can find that God is scrutinizingly doing all the work through the neural nodal system of our spinal cord, the sympathetic, parasympathetic, cranial nerves, etc. He is working, his force is working. You have to understand that. Then comes the third process of intricated pranayam. We get Tonu Manos Samadhi. Tonu means body and Manos means Prana. He lives within it. He lives within it and he can, and a practitioner can understand that. Then comes Asham Shakti. Yes, he is most powerful. In the fourth stage of pranayam, another higher technique of pranayam, he can feel that, yes, he is within, he is the most powerful, even omnipotent. Then comes Padatha Bhavini Samadhi. And all these are Shabikalpa Samadhi, having beach, the sound. What is sound? That is Onkar, Anahata Dhvani. There are 2 types of sound. This is Ahata Dhvani. I have heated myself, the sound has come. But one primordial sound that existed even before creation, that is Onkar. And Onkar has all the attributes. You know, all the mantras, even Gayatri goes and dissolutes in Onkar. What is Onkar? Onkar is nothing but fraction of, when we break Onkar, what comes out of it? It comes 16 vowels and 34 consonants. Ong, ang, ing, ing, ung, rim, rim, like this. So, Dr. Shubhamay Ghosh was there with, an experiment was done in a cave in Himalaya. These 50 letters were chanted and was recorded. Dr. Shubhamay Ghosh was there. And after recording these sounds, it was put into an overlapping software in a computer where all these 50 letters were chanted together. And what came out, you know? It came out, Om, this sound came out. So it means Omkar has 50 attributes. These are nothing but 16 syllables, 16 vowels and 34 consonants, out of which we can describe anything and everything of the world, but we cannot describe Brahma. The word that cannot reveal Brahma, you know that is Brahma. He cannot be revealed with words. He's beyond words. So to meditate, one has to go beyond mind, intellect, thought, body process, your body, sense of worldliness, knowledge, super knowledge, cosmic consciousness, and super conscious, and beyond cosmic consciousness. That is the stage of wisdom. So in the last process of pranayam, the 6th part of pranayam, this is very intricate. It's very simple, pinpointed. It is, if you take a hair follicle and divide it into crore parts, that much subtleties. When can you enter? You enter into pineal gland of your brain. Your heart stops, because in the 6 levels of the 5, with the pranayama, the Shabikalpa Samadhi, there was no respiration. Respiration was stopped. And you had been enjoying the spirituality, you got the knowledge of the world. But here, when your heart stops, that is suspended animation, you become a living dead and you get merged with God. The rivers flow into the Bay of Bengal. You cannot identify the water of Ganges in Bay of Bengal. You cannot identify the water of Brahmaputra in Bay of Bengal. Thakur Ramkur said,
Sorry to interrupt you, sir. We are really running short of time. There is a question
I must have.
to Dr. Maharaj.
Pranam to everyone.
Maharajji, Atapiyananda Maharajji, by Dr. Biplab Burman. He is asking the exact meaning of Amaya of Pranayama. May I please request Swamiji to please explain this?
Oh, this was so beautifully explained by our moderator Yogacharya ji, Chanchal Roy. So much he explained about pranayama. Ayama is control of prana, regulation of prana. So I request Dr. Chanchal Roy to tackle this word ayama in pranayama. You are an expert on this.
Actually, Dr. Bhargav has asked for Maya, I think. He has asked for what is the meaning of Maya, I think.
What is it?
Hello?
The word ayama in pranayama, what does it mean?
I am is with complete rest.
Yeah.
Complete rest of prana is I am. When there is no wave of your prana, it is complete still. As you go near to a pond, the water is waving, you cannot see yourself. And when the wave, there is no wave, zero wave, it looks like a mirror. That is I am. Then your reflection of soul is there. You can see your soul. Yes, he is there. He is Ungushta Matra Purusha. It has been said in the Upanishad. You can see that. Very well you can see that. That is I am, state of I am.
For practical purposes, we may take it to be a kind of a regulation in breath. So,
yes, Swamiji.
breath is continuously regulated, but breath is regulated, the mind becomes calm, and after some time, Kumbhaka automatically occurs. So, Kriya Yoga experts are here. We call it Ajapa Japa. Japa is performed without doing japa. They use the word Soham, Hamsa, etc. That means just like you are constantly breathing without your own knowledge that you are breathing. Japa is going on without you being aware that you are doing japa. That means your consciousness has risen to a level in which your consciousness merges with the super consciousness. Without your being aware of it, your I actually reduces. The sense of I largely reduces, and you live in a state of great placidity and tranquility when you get a lot of rest. It is called in Vedanta, it's called Atma Arama. Arama means you take a lot of rest. You simply dwell in the Atma and you rest. So the unregulated prana is what makes you tired. You feel, I'm so much fatigued, I'm so tired, because your prana is not properly regulated. So yogis say, when your prana is regulated, any amount of work you can do. So there is no limit to the energy that the human body has and the human mind has, provided you know how to regulate your prana. So if you're regulating the prana, you'll always feel great rest. You don't have to sleep separately. So therefore they say yogis conquer sleep. They are called Gudakesha. They conquer sleep, and when they sleep, even then they are in the state of great yoga called Yoga Nidra. These words are used because they always see the shining consciousness, whether it is Jagrat, Swapna, Sushupti, either waking, dream, or deep sleep. These are very advanced states, but even then we can practice it by being aware that our breath is not properly regulated. So if you can just calm yourself for some time, when you feel agitated, so calm yourself for some time, breathe steadily, and deep breath, rhythmic breath if you practice, slowly, step by step, as Dr. Chanchal Rai explained, slowly you can step by step, and you can go, but years of practice are required, and as he beautifully said, do you really want it? Most of the people want it, I want some calmness so that I can enjoy more. So if you want good health, if you want some calmness so that you can enjoy more, then of course you can try it out, but again you will be stuck.
From the core of our heart and soul, we'd like to pay our regards and gratitude to Swami Atmapriyananda Maharaj Ji and Yogacharya Dr. Chanchal Roy. Thank you, sir. Thanks a lot. With this, we would like to conclude today's session. We will meet tomorrow at 6 p.m. for the second day of the webinar. The first session will be on the topic, Integration of Yoga in Homeopathy, Opportunity and Challenges. Our respected speaker will be Professor Dr. Shubhamoy Ghosh, and the moderator for the session will be Professor Dr. Shwatadol Das sir. The second session, which will commence from 7 p.m., will be on the topic, Mechanism of Yoga from Bedside to Genomics, and the respected speaker will be Dr. Indranil Basure, and the moderator for the session will be Professor Dr. Shomiron Mondol. Last but not the least, the third session will be Integration of Philosophy of Yoga and Homeopathy, a realistic approach in clinical practice, which will be delivered by Professor Dr. Subhashish Ganguly sir and to be moderated by Dr. Pradeep Kumar Bairi sir. So we will meet again tomorrow at 6 p.m. sharp. With this, we would like to thank all the participants, the speakers, moderators for joining with us. May I now request our principal sir to please say a few words and conclude today's session. Over to you, sir, please.
Thanks to today's chief guest, Dr. Subhash Singh, and most respected our speaker, Swami Supriya Maharaj Ji Mohsha, Dr. Hemant Bhargav Ji, and others dignitaries. On behalf of our institution, I thanks to all the participants, all my colleagues, and today's anchor, Dr. Sangeeta, Professor Dr. Sangeeta, and other dignitaries. Thanks to all, and today's program, I declare the end, and thanks to the all members of the PG Welfare Committee also. Thank you.